All right. All right. Welcome back, everybody. My name is Dr. Khan Kao. I am joined by Dr. Thandi, and she is an ophthalmologist. So today she'll be talking to us about her specialty. Welcome, Dr. Thandi.
Thank you so much, Dr. Cow, for having me on. I am so excited to share about my profession with everybody. I actually found ophthalmology through a very circuitous route.
Uh-huh.
I, Actually, my whole life has been a very circuitous route, but that's a story for another day for sure. But I went to medical school at the Medical College of Georgia, and then I did my internship at Boston University Hospital in Boston. And then I took a little I took a break and I did a year at Harvard School of Public Health to get my master's in public health in health management. And then I went and did my residency in ophthalmology at Howard University Hospital in Washington, D.C. And if that wasn't enough, then I did a fellowship in glaucoma. Ophthalmology has a lot of different specialties. I did one in glaucoma, and then I worked for a couple of years and then went back and did a second fellowship in cataract and refractive surgery. So, and then I finally continued my working career. And right now, I've actually had the opportunity to practice medicine in a lot of different settings. I've worked for large HMO groups. I've worked for a small privately owned private practices. I've worked for private equity owned private practices. I've worked in the military. And now I'm actually in transition and planning to start my own practice. So that's a really exciting process. But when I was a medical student, I think for me, one of the big differentiators for what you're going to go into is, do you want to do surgery or do you want to not do surgery? Or probably the first one is, do you want to see people alive or do you not want to see people, right? And if you don't want to see people, then you might want to consider things like pathology, radiology, that kind of thing. But if you want to see people, then do you want to cut on them or do you not want to cut on them, or do you just want to do a lot of procedures but not necessarily surgery? And for me, I knew from a young age, I knew the minute that I walked into medical school that I wanted to be a surgeon. I loved the idea of surgery. I actually thought, after I read, you've heard of Ben Carson, right? He was the former presidential candidate neurosurgeon. I read his book, Think Big, and I thought, I want to be a neurosurgeon. But then I found out that some of those surgeries are like 18 hours. I was like, oh no. I said, oh my gosh, I would forget, like by the 16th hour, I probably would forget who I was operating on, why I was operating. I was like, that is not for me. And the great thing about medicine is that there's so many specialties for every personality, and whatever you like, you can do. Even non-clinical careers are available, which a lot of times people don't talk about. And I know I never even considered when I was a medical student. So I found out about these long neurosurgeries. So I said, no, that's not for me. But I liked the idea of doing surgery, but I also liked talking to patients. I liked having relationships with patients. I didn't want to just see all my patients when they were asleep in the operating room, and then once they recover, never see them again. I like the idea of continual lifelong relationships, and I love I'm a big supporter of women and women's issues. So when I started medical school, I thought, and one of my mentors also was an OBGYN, so I just knew I was going into OBGYN. I get to operate, I get to do clinic, I get to work with women, I get to bring life and babies into the world. It was like, this is so cool. I mean, I still think that I think that life is an amazing process. So something very interesting happened to me in medical school. And I went to medical school when I was 25, and I had never worn glasses before. And all of a sudden, I'm noticing like, I'm not really seeing as well. And there was this whole thing of denial. And I was like, oh no, I'm just stressed out. Oh no, I'm tired, but no, turns out I needed glasses. And that was the first time that I realized the importance of the eyes and what a difference that makes. So that was one thing that happened. And then another thing is that there was this really amazing attending at my medical school named Dr. Kathleen Stern, and she was just so cool. All of her patients loved her, all the staff loved her. And I saw a LASIK surgery with her. And in 10 minutes, this patient went from not being able to see, almost like nothing, legally blind without their glasses, to being able to see the clock on the wall. And I have, to this day, I have never seen anybody happier. And I just thought it would be so neat to be a part of that. But I hadn't left the idea of OBGYN completely, but I started looking at ophthalmology and I said, this is something here. And I was actually the student president of the OBGYN interest group. And interestingly, so I think one of the things that I have for your listeners is, if you're still trying to figure out, if you're not decided, if you think you like this, but you're not sure, that's okay. You'll figure it out. The answers will come to you. And sometimes, like, I have a girlfriend who actually got into an ophthalmology residency in her senior year and decided she wanted to do derm. And she ended up having to wait 2 years to get into a derm program, but now she's a dermatologist and super happy. So it's okay to not know, and it's okay to be changing your mind. But back to my story. So in my third year, when we started doing rotations, I happened to do a rotation in a state hospital. And I thought OBGYN was going to be kind of happier, helping to give life and, nothing too sad. But there was like a 14-year-old who was having a baby. There was a crack mama who was having a baby. There was a nice married couple that were having a miscarriage, or it was like all this like sadness that I hadn't really counted for. And then on top of that, the people that I was around, and now granted, I was in a residency program. I think people in private practice have a different experience, but the ones that were residents and attending, they looked miserable. So I was like, I don't know about this. And when I went to do ophthalmology, it became more and more appealing to me. And that's how I ended up choosing ophthalmology.
Wow, that's a great route that you've taken to get where you are, and finding the joy and the passion in ophthalmology, and also just, you had a sense of what you wanted to do, and that OB-GYN or surgery, and then how you were able to rule them out, and also found ophthalmology. That's incredible. I think a lot of students are probably, like you said, are a similar boat. I thought I was going to be a pediatrician. I was like the president of the pediatric club, and then I did a rotation in pediatrics. I was like, too many well child checks, not for me. But thank you for that. So can you tell us the training path for ophthalmology?
After medical school, and the other cool, really neat thing about ophthalmology, it's the fastest surgical subspecialty. You can't, there's not any other surgical path that you could do faster than a surgical subspecialty that you do faster than ophthalmology. So after medical school, then you have to do a residency. Well, first you have to do an internship year. So you can do a year either in internal medicine, or a year in surgery, or a year they call it a transitional year, which is a mixed match year where you go to all the different departments. And then you do a 3-year ophthalmology residency. And at that point, you're an ophthalmologist, you're free to hang up your shingle. But if you choose to further subspecialize, there are 8 different subspecialties that you can choose from. So I did glaucoma, and I also did a fellowship in cataract and refractive surgery. There's other fellowships that you can choose from. If you want to do, if you like kids, which I don't, God bless you if you do, but you can do pediatric ophthalmology.
Mm-hmm.
You can do cornea, which cornea is really cool because that's the subspecialty that transplants eyes. They literally take the eyes off of dead people and put them onto live people and make them work. It's amazing. So that's cornea. Then there's uveitis, which is the people that deal with inflammation in the eye. If you're really into cancer, you can do oncology. If you don't want to see people that much, you could do pathology. So you can do ophthalmology and still not see people or operate. And then there's neuro-ophthalmology. If you're not, actually, neuro-ophthalmologists usually don't operate. So, but they're the smartest ophthalmologists. They're that, like, when we can't figure things out, we say, oh, we got to send them to the neuro-ophthalmologist. And then there's oculoplastics, which is they do some cancer stuff, but they do a lot of cool like plastic surgery features. So it's almost like all the other medical specialties are represented in small amounts in the ophthalmology fellowship tracks. And of course, you don't have to, once you do an ophthalmology residency, you get exposed to all of that so that you can decide at that point what you want to do.
Yeah, that's a very diverse aspect of ophthalmology subspecialties fellowships. Are there certain qualities that makes a successful ophthalmologist?
Absolutely.
Okay.
Number one, you have to like people, unless you do pathology, but you have to like people because people, your patients will be with you. These are lifelong relationships that are established, that you will see them sometimes from the time they're little kids to the time they die. So if you want to have continuous lifelong relationships, that's really important. You have to like learning, because there are so many technology advances. I mean, even just from 2 years ago, there have been like so many new surgical techniques, so many more new medicine. So you have to be willing to keep up. You have to be willing to learn new things, and you can't just be happy and satisfied with what you learned in your training. So it's really a lifelong learning skill. You also have to, well, you don't have to like surgery because but most ophthalmology specialties involve surgery. So, but you don't, like I said, you don't have to, you can not do surgery, and you have to, what else? So you have to be able to have good relationships, surgical skills, and lifelong learning. I think those are the top three.
Okay, awesome. Thank you for that. And then what do you find the most exciting aspect of your job?
The most exciting aspect is when I can give people their vision back. I mean, just like right now, I ask you too, just like close your eyes just for
All right. I'm going to close my eyes. All right.
I'll close my eyes too. And if you guys are listening, close your eyes. Just close your eyes. Now imagine if what you see right now with your eyes closed is all you could see, like for the rest of your life. Imagine how different that would be. Okay, now open your eyes. Open your eyes. Like, can you, like, isn't like the fact that we can see, it's one of those things that's easy to take for granted. But when somebody can't see, it changes their life. And with cataract surgery, sometimes we take people who are legally blind and we allow them to see. We help them to see. And right now in America, it's a lot of times we do cataract surgery earlier on, but sometimes when you go into other countries where people don't have as much access to care, like people are literally blind and they are coming in with a family member to lead them and guide them. And when you do a surgery, a 10-minute surgery, a 15-minute surgery, and that person can see again, you've given them their life back. And I don't think there's anything cooler than that.
Yes, that is very cool. And on the other side of the spectrum, what do you think is the most frustrating aspects of being an ophthalmologist?
Well, there's a few things, but from a patient perspective, as a glaucoma specialist, now glaucoma is one of the leading causes of blindness, and it's largely asymptomatic, so it means people don't know that they have it, and sometimes people are losing their vision, and we can do a surgery and it doesn't work, or it works for a little while and then you have to do another surgery. So glaucoma surgeries can be very challenging. And sometimes even you could do on the same person, different eyes, you do the same surgery in the same way on this eye and the surgery works well. And then you do it on the other eye and that surgery is a total disaster. And so that can be frustrating when you don't get the results for people that they want. Another thing that frustrates me as a woman, and I think it should frustrate all of us, is the pay gap between men and women. Women ophthalmologists still make 60 cents on the dollar compared to their male counterparts. But we don't do 60% of we don't do a 60% job. We do the same surgeries, right? So I am a big advocate of gender equity pay, fair, same pay for same work. And then the other thing, especially as a Black woman, is the lack of diversity in ophthalmology. Less than 0.3% of all ophthalmologists are African Americans, whereas in the United States, about 12 to 14% of our population are African Americans. So it's there's a lot of underrepresentation of minorities in the field. And I think that finally now people are starting to talk about it, and people are starting to look at ways of why this is and what can we do about it. So those are the three things that are most frustrating. Sometimes the surgical outcomes that are unsatisfactory, and the pay differences between men and women, and the lack of diversity in our specialty.
Okay, awesome. Thank you for that answer. And what are some myths about ophthalmologists that you think are untrue or unfair?
You know, I was thinking about that, and I don't think I've heard any myths. I think maybe some people perceive that we don't work hard, but we do. We do, and it's not all like sipping Mai Tais by the pool at 3 o'clock. Although one of the great things about ophthalmology, when we take call, we take at-home call. We don't have to be in the hospital, and when you're in residency, your call is busy, but once you leave residency, there's not really that many true ophthalmic emergencies where you have to go in the middle of the night. So we don't work as, it's not like OB-GYNs who have to run into the hospital and give babies at 3 o'clock in the morning. So it's not that tough, but we still do work hard. But one of the nice things is that if you work for yourself, you have the flexibility of scheduling your own hours.
Awesome, thanks. In my time as a ER physician, I rarely call ophthalmology for a consult, except for last night. It was I had to call. It's a globe rupture.
Oh, well, yeah, you have to call.
Yeah, it's like the little kiddo stabbed himself, accidentally. So I had to call, and ophthalmology took him to the OR. But yeah, it's very rare that I call ophthalmology for consults. And so you kind of touched base on the work-life kind of integration. Can you discuss a little bit more about that, how your schedule works? It seems like you work different aspects of corporation, HMO, and things like that. Can you discuss how being an ophthalmologist affect your work-life integrations?
Yeah, absolutely. And we'll start with the HMO. And actually, I talked to I talked to somebody who, there's a very large national HMO that has offices in California and also on the East Coast and probably in between. And that's one interesting thing. So it's the same company name, but in the different geographic regions operates very differently. So when I was in Mid-Atlantic area, they had zero opportunity for flexible hours because you worked Monday through Friday, no exceptions for nobody. But yesterday I talked to someone who worked for the office in California, and she works at 80% schedule. So she works 4 days a week. So they have flexibility. So it's impossible to generalize. But so when I worked 5 days a week, I'm also in the Army Reserves where I have to do 2 days a month. And at that time I had a little baby, and I felt like I was never seeing the baby. I would get home because in that job, we also had patients could email us, and we had to do all this. We had to do all this work afterwards. So one of the things to consider is not what time you stop seeing patients, but what time do you actually go home, right? So we might have stopped seeing patients at 5 o'clock, but I didn't get home on most days until 7 o'clock. And the baby went to sleep like at 8 o'clock. So I was seeing my baby for like 1 hour a day, and it sucked. And I decided, I don't want to do this. I'm not doing this again. And it's interesting when you ask and decide what you want, it's amazing how easy it is to actually get it. So after that, I said, I am not working 5 days a week for someone else ever again. So then I went to 4 days a week, and that was working pretty well. But then, and when I went to a private practice, and when I signed up with the expectation that I'm working 4 days a week, and I wasn't going to consider any job that did not allow me to work 4 days a week. So since then, I had been working 4 days a week. Then I started another business that is outside of my clinical practice. And it's like, well, when am I going to have time to do this business and sleep and eat and see my kids? Yeah. So I said 4 days a week isn't working either. Let me try 3 days a week. And now I'm down to 3 days a week, and I found people that were open to that, or companies that were open to that. So yeah, and that's great, because a lot of times people are so scared to ask or to make the change. And the truth is, if something is not working for you, whether it's like some people go to medical school and then they realize that I don't really want to be a doctor, but because they've put that all that energy and effort and money into it, they feel like they're obligated and they have to be miserable for the rest of your life. You actually don't. We all have choices. We all have choices. And if something is not working, if you are not happy, make a change. Make a change.
I appreciate that advice. I wholeheartedly agree with that, and it's interesting, like you said, if people know what they want, and truly know what they want, and like introspection and whatnot, they hopefully they can seek out the opportunities out there that can match what they want. For example, I told myself I was never ever going to work full time, so now I work about seven shifts a month, just to keep myself alive and be able to do other things with my life. So it's amazing that the choices that you made to keep your work life integration to be happy. That's fantastic, and thank you for that. So on, I guess, on the business side of it, or the clinical side of it, do you work with mid-levels such as NPs and PAs, and do you see their responsibilities changing?
Actually, I have not worked with PAs. There are ophthalmologists that work with PAs who can do things also in the operating room, which is really neat. But what a group of doctors that we do work with, which I don't know if you would consider them mid-level per se, but is optometrists. So optometrists, and people mix up optometry, ophthalmology all the time.
Hmm.
Optometrists go to optometry school for 4 years, and they are doctors of optometry, and they are trained to dispense glasses and contact lenses and treat um, medical ophthalmic conditions. But if something is more complex, then a lot of times they'll have to refer to an ophthalmologist. But I have found that in the practices that have the most successful working models, the optometrists and ophthalmologists are working together well and co-managing patients.
Mm, okay. Thank you for that differentiation between optometry and ophthalmology, because some of us don't know. All right. So, what do you see ophthalmology changing 10 to 20 years down the road? Because you touched upon how it's ever lifelong learning aspect to it.
Yeah, absolutely. The people who were practicing 20 years ago, even 10 years ago, probably couldn't imagine the changes that we would have today, because the technology is really moving at a fast pace. And one of the things that I anticipate is that with all of this, with the advent and all this research on nerve regeneration, I believe that that science is going to start to have relevance in the eye sphere. Glaucoma, which is a disease, the specialty, one of my subspecialties, is a disease where the optic nerve gets damaged irreversibly. So once someone goes blind from glaucoma, that vision cannot come back. It's like, sorry, paid it for you. Here's a walking stick.
Mm.
Speaking of which, let me just do my public service announcement for all of your listeners, and you too, doctor. Please make sure you get your eyes examined at least once. I mean, you should do it more often, but get them examined at least once, and have somebody look at your optic nerve with a while your eyes are dilated, and specifically ask them if they see any signs of glaucoma.
Mhm.
Because the problem is that people can have glaucoma and not know it for years and years and years. And if we catch it early, right now we have the technology to prevent it from getting worse. But if it gets worse, there's nothing we can do. However, with the new science and new discoveries, I believe that we will start to find ways to take people who are blind and restore their vision from different diseases. There's already some research around that, and I think that that is going to grow. We're going to continue to have new surgeries and technologies that work better and are cooler and more effective. And I mean, I really can't even imagine what it's going to be like, but I'm really excited, and I hope to be around to see it.
Yeah, that's fantastic. Okay, I'll note to myself to get my eye checked. I actually never got my eye checked before.
You've never gotten your eyes checked? Oh my goodness. Next time
uh,
you call the ophthalmologist, say like, can you?
I was like, oh, my vision's great. I was like, I don't need my eye checked, but yes, I appreciate the public service announcement. And then regarding job market, what do you see like for the current listeners who are students? What do you see as a job market for ophthalmologists if they do end up choosing to be going to residency and whatnot 5 to 10 years down the road?
Well, one of our biggest surgeries that we do is cataract surgery. And
Hmm.
who gets cataracts? Old people. And which old people? All old people. Like everybody, if they live long enough, will develop cataracts unless we come up with some other technology to prevent that from happening. But the way it is right now, every old person who gets old enough will develop cataracts. Some people could go for a long time and have cataracts and still maintain good enough vision. But with all these baby boomers and the number of old people in this country growing, there is a growing need. We really don't even have enough ophthalmologists to take care of all of the people in this country that will need ophthalmology help. So definitely there is a huge job market for that.
Mm, awesome. Thank you. And it seems like there's a lot of career opportunities outside of being ophthalmologist. And you could talk about your other side gigs, if you like, as well, and what you know of other ophthalmologists doing as their other career opportunities.
Yeah, absolutely. And the one thing I do want to say about the job market, which is important, is that there is, like most other specialties, the ophthalmologists tend to be more saturated in large metropolitan areas, like places like Washington, D.C., where I live. They, like if I throw a rock, I'll hit an ophthalmologist. It's very easy. Whereas you could go to Mississippi and there might be one glaucoma specialist for 500 miles. And interestingly, not that money is everything, but if that's one of the things that you're taking into consideration, if you live in a more rural area, the chances that you will more likely make a lot more money than the people that live in the cities where there's not as much of a need. But okay, wait, ask me your last question again.
Yes, regarding other career
Oh
opportunities.
yeah, other careers. Yeah. So one of the great things about medicine in general that nobody talks about is that there are so many different other options, and there are things that you can do on the side. We kind of think, okay, well, our options, I can either go work for somebody or set up my own practice, but there are people who do things like, some people make money as legal experts, where they when there are malpractice cases, they usually involve expert witnesses on both sides. So there are people that work on the side of the doctors and the people that work on the side of the patients. That's one thing. I have a friend, there's always pharma. So there's a lot. I'm actually in a company that's really neat. It's called Untitled Therapeutics, and we are developing a therapeutic for COVID right now, and we're getting some promising results. So hopefully that will be on the market soon. So I'm in that company in the role of medical affairs. And there's many other roles. If you like research, you mean clinical research. I had my co-resident, she went to work for the FDA, which was really cool because she got to do all the science and research, and she got to be a part of the approval process of bringing new things to market. So that was cool. And then of course, there's a whole other, like the entrepreneurial possibilities are really endless. Like you can do anything, whether it's related to medicine or not. For me, one of my passions, because especially seeing the amount of burnout that we have in medicine, and I'm not sure if you're aware, but the leading cause of death for female physicians under 35 is suicide. And physicians have one of the highest rates of suicide out of all the professions. And with the decreasing reimbursements from insurance companies and companies requiring doctors to work harder, and I don't want to depress people and not make them want to go into medicine, but I guess it's good to be aware, right, of what's going on. And so companies, so let's say before, if you were seeing 20 patients, that's what the company needed in order to keep their lights on and make whatever money they wanted to make. Now that the reimbursement is down, maybe you have to see 40 patients. And so you're working harder and it gets harder. And a lot of times doctors in the hospitals are not feeling as respected or valued, and people can burn out. And we need to have sources and resources of that will help keep us surviving and also thriving. And so that's one of the reasons why I started my coaching practice. My life coaching practice is to help. My mission is to help end suffering for women physicians. Which is a big mission, but I really want it. It turns out that when doctors are happier, we take better care of patients. And a lot of people are leaving medicine altogether, but I don't think that that's the solution either. I think we need good people who care about people and want to do good in the world. We need them to stay in medicine, and we need to make sure that they are okay and that they are happy. So that's one of the things that I work on in my practice, my coaching practice.
Awesome. Thank you. Thank you for that vision and mission that you have to help female physicians. And I guess people find you for this coaching, so that way, if a female physician wants help, they find you.
Oh, absolutely. I'm on social media.
Mhm.
I am on um, Facebook. I have a Facebook group on page called Happy Doctor Mom.
Okay.
And I'm also on Instagram with that same name. And I don't know if I have a Twitter, but Facebook and Instagram for sure. And I guess Clubhouse, you can't really contact people, but and if anyone just has any questions and they want to reach out to me, you can email me at happydoctormom@gmail.com.
Okay, I appreciate that. I can put the link when I post a video as well, so that way, hopefully, you'll be able to help the physicians out there and stay happy in medicine, which is what we all want.
Yeah.
Um, your background is quite diverse. You've given us a lot of great advice and tips. Do you have any uh, more top tips that you want to give to students who are interested in going into ophthalmology?
Yes. Number one, which everybody knows, you have to do research, get involved in research projects, talk to the ophthalmology attendings, or to see if there's any people always want free help. So
Mhm.
talk to them and see if you can help them with any research that they're working on. So that's important. And just as important, network with ophthalmologists, particularly the ones that are in academic institutions. Like you can, I mean, everyone helps. It helps to network with as many people as you can. But I'm not in an actual residency program, so I have nothing to do with their decision making process. But go to the meetings if you can. Talk to people. Just talk to people. A lot of times people are afraid to talk to people. Ask them for help. People love giving help and advice. Like I want to hi to hi, chairman of ophthalmology department, so and so. I'm really interested in ophthalmology, and you have a great program. What is the best way to increase my chances of getting into your program? So the networking, who you know, is huge, and it will make a huge difference if somebody has known you for 3 or 4 years. You will have, and likes you, of course, you can't be a jerk, but you'll have an advantage over some random stranger that they don't know. And also do visiting rotations, because not only do you want them to know you, you want to know them, right? Because what if you hate living in, like, Iowa has that excellent program, but what if you hate living in Iowa? What if the people are just way too friendly for you? Like, I don't know, like, just, when you do visiting rotations, it really gives you an idea of how you would fare in that program. So
Okay,
research, network, and visit places.
awesome. Thank you. And then, ophthalmology is one of the more competitive fields. So I appreciate the advice on getting students to be more competitive to hopefully match into the residency as well. And
Can I say one more thing? One more
yes,
thing.
yes, for sure.
The last thing is that if this is what you really want to do, don't give up.
Mm,
Don't give up. I know someone who he applied for ophthalmology his first year. He didn't get in, and he actually did we have some fellowships which you can do before residency. He did a pathology fellowship, and which made him more competitive. And he applied again, and he got in, and now he has his own private practice and is thriving. Like I said, I told you about my girlfriend before, who had actually gotten into ophthalmology but decided she wanted to go into dermatology. It took her 2 years, but to get into derm, but now she's a dermatologist. She'll be a dermatologist for the rest of her life, and she's in a career that she really loves. So if this is what you want to do, don't give up. Just do what you have. If you don't get in the first time, get advice on how to strengthen your application and apply again.
All right. Thank you for that as well. And is there anything else that you also like to add that I miss that students should be aware of?
Hmm. Just no, I think that ophthalmology is a fantastic specialty. I personally feel like it's the best one, but it's not for everybody. But there is something for everybody. There's a lid for every pot,
Yeah.
and just a matter of finding yours. And you can even and the truth of the matter is you can even change after you picked a specialty. Some people start in one specialty and flip to another, so it's never too late. So find what you love and trust that you will find what you love.
I appreciate that. Thank you, Dr. Tondi, for spending your time with me and then also sharing your knowledge with the students. I very much appreciate you doing this. You have a busy schedule and whatnot. So I appreciate you doing this again for me and then also for the students.
Oh, this is so much fun. I think it's so awesome that you're doing this. I wish that I had these videos available to me when I was choosing a special subspecialty. So thank you for the work that you're doing.
Yes, I appreciate that. Thank you.